Joining us now is Dr. Parvathy Nair. Welcome, Dr. Nair.
Thank you.
Dr. Nair, Sophie talks about having what she called a heart event. How common is that amongst women?
So I think what Sophie meant by a heart event is a heart attack. And heart attacks are very common. In fact, it's the #1 killer of women in worldwide, North America included.
That's a little bit shocking, and most people don't think of heart issues as those related to women. It's generally been marketed as something that is a man's problem.
Yeah, for decades it was thought of as a primary man's problem, but over the past 10 to 15 years, women, the medical community has become increasingly aware that this is actually the #1 killer of women as well.
Are women more likely to die if they do have a heart attack relative to a man?
Yes, that particular issue is a little bit complicated, but yes, because women present later, they present when they're older and they have more comorbidities, the word we use to describe other illnesses. Because they're older and have more other illnesses at the time of presentation of heart disease, they're more likely to die with their heart disease.
Are the signs of a coming heart attack different for women than they are for men?
It's true that women do present differently and can present more differently than men, but the single most common way for a woman to present with heart disease is chest discomfort or chest pain.
Once a heart attack has happened, what's the prognosis for a woman moving forward in her life? For a man also, how can they expect to live a healthy, good life, or are they going to have to be super careful?
If a person presents very late in their heart attack, they can suffer damage which is permanent. If they present early and very minimal damage has happened, then it is possible for them to live a heart healthy life and their prognosis not be affected significantly.
What do all of us need to watch for to minimize the possibility of a heart event?
Yeah, once you have a heart attack, it's a little bit different. Once you have a heart attack, it's important to see your medical practitioner regularly. It's important to take your medications, very important to take your medications, and not stop after 2 years because you feel great. Also, after a heart attack, it's important to engage in heart-healthy behaviors like eating a good diet, avoiding smoking, not smoking, exercising regularly. These are important things to do, and including keeping an ideal body weight or waist, hip circumference, little markers of weight control. For a person who's never had a heart attack, never had heart disease, the medications aren't as important. It's those lifestyle adjustments that are the most important. So for instance, we know that the simple issues of eating a healthy diet, exercising regularly, not smoking, keeping an ideal body weight, and moderate alcohol consumption, these 6 factors can reduce your risk of a heart attack by 80%. So for most of us, these are simple, eat healthy, live well. They're not just little words, they're actually very important. They have a massive impact on your risk of heart disease.
So it's that darn word moderation that
yes.
is going across the board.
Yeah, and live healthy, right? Yeah. All the things that I think all our mothers told us to do, they should probably have listened to it themselves, but also we should listen to them because they actually do change our risk for heart disease.
Okay, Dr. Nair, thank you so much. Very useful.
North of 49, a guide to the rest of your life.